Alright, this video will wrap up our lecture material for this week, and we're going to finish off talking about spinal nerves. So spinal nerves are any nerves connected directly to the spinal cord. These are a combination of both sensory and motor axons. These will separate into the two separate nerve roots, so we touched on that a little bit in the previous video talking about the spinal cord and those nerve roots. So all of the sensory axons are going to enter the spinal cord through the dorsal nerve root, and then all of the motor fibers, regardless of whether they're part of the somatic or autonomic divisions of the nervous system, are going to emerge as the ventral nerve root coming out of the spinal cord. So sensory axons go into the spinal cord. The motor axons, motor fibers, are going to leave the spinal cord. So again, sensory information comes into the central nervous system, is processed, and then we generate some sort of response through our motor fibers or motor nerves. So after the nerve roots and the spinal nerve exits that intervertebral foramen in between the different vertebrae, we will split the spinal nerves into two branches called rami. So we have the dorsal ramus and ventral ramus. These were covered in lab recently as well. The dorsal ramus is going to go towards the posterior side of the body and give us sensation on deeper muscles and then the skin of the back. And then the ventral ramus are going to split into multiple branches going to basically the entire rest of the body, so the anterior and lateral portions of the trunk as well as arms and legs. All right, and so those rami can also combine, the ventral ramus can also combine into the plexuses. So we talked about those in lab recently as well. So we've got the cervical plexus, brachial plexus, so on and so forth. And those are collections of the ventral ramus. All right, and so the spinal nerves can also be associated with a couple other branches called the rami communicantes. These are going to connect the spinal nerves to the sympathetic chain and those ganglia of that sympathetic chain. So those sympathetic ganglion that were also covered in lab recently. So spinal nerves are basically numbered. They generally are not going to be seen in a lot of other ways. We do have some names for some of them that were covered in lab recently, but just like the cranial nerves, they've got a number and then another name. So there are 31 pairs of spinal nerves. Again, numbered, named for where in the spinal cord they're found. So we have 8 pairs of cervical nerves, 12 pairs of thoracic, 5 lumbar, 5 sacral, and then 1 pair of coccygeal nerves. So very, very down at the bottom of the spinal column near the coccyx. So the axons, again, from the ventral rami come together in a nerve plexus, which we have covered some of those in lab as well. So here's our spinal cord right here, gray matter, white matter. There's that dorsal root. Here's the dorsal root ganglion, ventral root coming out here, and those join together outside of the vertebrae at the spinal nerve, and then that spinal nerve will send off the dorsal ramus to the back side of the body. Ventral ramus will go to the lateral and anterior portions of the body and arms and legs. All right, we did not cover the white and gray ramus in lab. You'll see these on a couple models here and there, but these were not terms that we covered in lab specifically. So I'm not going to spend too much time talking about them, but those are what's going to end up connecting the spinal nerves to those autonomic ganglia in the sympathetic chain. So some models will show that rami communicantes, which is basically a combination of those two. So here's the plexuses. The cervical plexus innervates the head and neck, brachial plexus to the arms, lumbar plexus to the pelvic region and anterior side of the leg, and then the sacral plexus innervates the posterior side of the leg. And then we do have intercostal nerves. These are not part of a plexus, and these are going to go to the thoracic region in between each of the ribs initially, so T2 to T11 are the intercostal nerves, and then T7 to 12 help innervate the abdominal region specifically. So here's a different way of looking at those plexuses and some of these nerves. Obviously, there's better views with some of the models and images of models that we have for lab recently, but cervical plexus is really high up, so this can be helpful if you're having a hard time seeing where these different plexuses are located, because certain pictures and images show them a little bit differently. So generally that cervical plexus comes out between C1 and C5, brachial plexus from C6 to T1, so kind of spanning cervical and thoracic vertebrae. Lumbar plexus is further down here. I know this is really hard to see, but this is L1 down to L5. And then the sacral plexus is coming through the actual sacrum. So we're not going to have those vertebrae numbers again, but these would be sacral vertebrae. They're just fused together in the sacrum. So the phrenic nerve comes out from the cervical plexus. Axillary, median, radial, ulnar, and musculocutaneous are all coming out of that brachial plexus as far as the nerves that we are learning in lab. From the lumbar plexus, you'll just need to learn the femoral, but there's also this obturator nerve listed in here too. And so that's just not one that you need to know for lab. And then the sacral plexus will give us that big sciatic nerve, and then that sciatic nerve will split further down the leg into the common fibular and tibial nerves. So those are the main nerves that you've been asked to learn for lab. So the sciatic nerve, this is the cause of the infamous condition sciatica, and so sciatica results from compression or irritation of this particular nerve, or any of these spinal nerves that are creating the sciatic nerve, and so that will cause a variety of symptoms depending on the person and the exact cause of the issue and severity. This can be some numbness, tingling, weakness, stuff like that throughout the hip and leg or different portions of the leg from that sciatic nerve. All right, let's talk about dermatomes. So spinal nerves that contain sensory fibers with endings in the skin, so the spinal nerves that are going to go to the skin, connect in with the dermis of the skin in a topographically organized manner. And topography is also a term that you'll see with map making and stuff like this. So this basically just shows where certain nerves are connected to. And these are illustrated as what are called dermatomes. So this is just an illustration. So these are really important in clinical settings, so in a hospital or some sort of healthcare setting, because they can help us identify potential damage to various spinal nerves by knowing where these different spinal nerves are connecting into the skin. So this is a dermatome image. So this is our map. All right. So the cervical nerves shown here, so cervical nerve 2 and 3 is going to innervate kind of the back of the head, the scalp, as well as this anterior portion of the neck. Trigeminal nerve goes to the face. You can see cervical nerves 3 and 4 here going to kind of the posterior neck and shoulder. Nerves 5 and 6 are coming down here, those cervical nerves down the lateral side of the arm to the thumb, and I'm not going to go through all of these, but this should give you an idea of basically if you're kind of doing like a skin prick, so taking a sharp-ish instrument. Obviously you don't want to be puncturing the skin ideally, but something a little bit pointier, like the tip of a pen or pencil or something like that, a sharp pencil. If you're kind of pressing on a certain area, you know, like right about here, then if the patient is not sensing that, maybe they just feel pressure and no pain, or maybe they don't feel anything, that can indicate potential damage to that particular spinal nerve coming out there. So spinal nerve, thoracic spinal nerve 8 could indicate, again, potential damage there if there's no skin sensation in that region. All right. And so that's why a lot of times with injuries to like the lower back and stuff, there will sometimes be tests done of, again, kind of poking and prodding at the skin in the feet and legs to kind of see where that damage might be from these different spinal nerves. All right. This also kind of clues us into why certain conditions and certain types of pain can be felt in other areas of the body. So, for example, myocardial infarctions, a heart attack, obviously that's going to create pain here in kind of the center of the chest where the heart is located, but we've all kind of heard that one of the key symptoms of a heart attack is pain radiating down the left arm, and that is called referred pain. And it again has to do with this kind of dermatome setup. All right. So the myocardial infarction, referred pain in the chest, left shoulder, and left arm, because the sensory fibers going to those cardiac tissues, the heart, travel through T1 through T4. All right. So there's T2 through 4 right there. T1's out here though. And so that pain can kind of radiate down the arm and shoulder on the left-hand side of the body. There's also cases where if the spleen has been damaged, the spleen's going to be further down here. You can get referred pain up in the shoulder area and neck area too. And it just has to do with all of this overlapping sensory fibers in different areas of the body. And that wraps up chapter 12.